The government needs to stop spreading misinformation about food and nutrition. They need to stop purchasing with U.S. tax dollars dangerous foods. We do this in almost every school lunch program in the United States. Heck, we strip the fiber out of the food and feed it to kids like sugar and call it bread, even though it's really not bread. And we've got to sometimes help support these school lunch programs with subsidies to buy healthier foods.
Doctor, where does this podcast find you?
I'm in New York today.
Let's bust right into it. Your new book, Blind Spots, When Medicine Gets It Wrong and What It Means for Our Health, is an eye-opening book about the latest scientific research on the biggest health topics of our day, including hormone replacement therapy, peanut allergies, cholesterol, gut health, and rising levels of cancer in young people. Let's start there. What does modern medicine get wrong? What are the biggest blind spots?
Well, modern medicine is so busy billing and coding and seeing patients in short visits that we've not been talking about the root causes of so many of these diseases that are on the rise, and with cancer on the rise in young people. And so we've got to talk about our poison food supply and the chemical ingredients that are engineered and added to our food that are banned in Europe and Canada. Now, we've got to talk about environmental exposures that cause cancer, not just the chemo to treat it. And we've got to talk about school lunch programs, not just putting every kid on Ozempic when they get overweight. We've seen this massive explosion of chronic diseases in our lifetime. Didn't exist 2 generations ago. Doesn't exist in many parts of the Amish community that still use good farming and eat food from the soil. And it doesn't exist in many parts of the world. So we've got to look at what we're doing differently. Those root causes have been in our blind spots.
What you say really resonates. The first thing I noticed, we moved to the UK 2 years ago, and I'm not exaggerating. The first thing I noticed was that everything in a refrigerator went bad or spoiled in 2 or 3 days. And what I recognize is that's a feature, not a bug. It's because they're not putting all the preservatives and shit in it. Is that part of the problem, that in order to increase economics and decrease the perishability, we just put too many things in our foods that aren't healthy?
I've got patients that have chronic pain and nothing works. We try everything in modern medicine, but then they come back and say, I spent a summer in Italy and for the first time I felt healthy. And what's going on is they're eating healthy foods, foods that are designed to go bad after some time. They don't have these chemicals designed to increase the shelf life. So that's a part of it, along with pesticides that are, killing insects in the crops, but they're also killing our gut microbiome, the bacteria that line our gut. So there's so many factors, but that's exactly the sort of thing right now that we need to take a hard look at.
If you thought, okay, I don't have the money or I don't have the energy to totally reconfigure my diet, what are 2 or 3 things you could do right away that would take out, say, a disproportionate amount of the risk factors in your diet?
Well, I hear that a lot. I hear organic food, which is food without pesticides, costs too much. And I tell people, try the cost of insulin, because a lot of these things going on today are the direct result of our poison food supply. How else do you have 40% of our nation's children that are overweight or obese and just 5% in Japan? Our kids in America are not more disobedient or more addicted as a part of their personality. No, we've poisoned the food supply and created highly addictive foods that have things like food dyes. So food dyes, for example, are mostly banned in Europe and Canada. So Kellogg's makes 2 types of Fruit Loops. One with the banned ingredients for the American kids that makes the food look all colorful and shiny, and one without the banned ingredients that they ship to Canada. So don't American kids deserve the healthier version of food made by an American company? California just banned 7 food dyes. 10 other states have some bans on these dyes. But I would say read the ingredients. Simple messages I tell patients: drink water, avoid these sugary drinks, avoid processed food with lots of ingredients, and watch out for seed oils. They sound natural, like vegetable oil and canola and soybean oil, but they're not. They're denatured at high temperatures, and then a chemical solvent is used to change the structure. So these are really chemicals. And when they hit the GI tract, guess what? Your body's immune system reacts to them. These are things that do not occur in nature. and your body is reacting with an inflammation. It's not a big inflammatory storm, it's a constant low grade inflammation, and it makes people feel sick. And we need to address these root causes, not just medicate everybody that comes in with these sicknesses.
I want to put forward a thesis and get your response to it. I've always thought that, unfortunately, in areas that are especially important to the well-being of our society, when you inject the profit element, there's some good components to it, but there's a lot of bad components. And I've always thought that essentially the industrial food complex has a profit incentive to get you addicted to terribly addictive, sugary, terrible food such that they can hand you over to the industrial diabetes complex where there's a ton of money. Your thoughts?
Well, I think you're right. The food industry started off with a charge to address food insecurity and world hunger. And so they started creating techniques, genetically modifying food, adding pesticides after it was discovered in the days after Agent Orange that it would kill insects, but it also killed the crops. So they genetically modified the crops to be so-called Roundup ready. That's where they could tolerate the pesticides. Well, that's our modern day food supply. But the problem is human beings are not made Roundup ready. So it's poisoning the
Hmm.
human body as well. So look, I see the best in people, and I think the food industry started off with this commission, this charge to mass produce food. Now we have to educate people about the unintended consequences of all these chemical ingredients in ultra processed foods and foods laced with pesticides. For example, pesticides have hormone like binding properties. Food dyes are hormone disruptors. Is it a surprise that the average age of puberty goes down by a week and a half every year for the last 30 plus years? It's now years sooner than it was a generation ago. That sperm counts are down 50% in the last 5 decades. That rates of GI cancers are increasing. So these are things we don't talk about in medicine. I got zero of this stuff in medical school. But now that I've taken the effort to learn about it, research it, and summarize it for folks, I'm going directly to the public, as a bunch of doctors are now, to try to educate people about what's happened to our food supply.
Describe your diet. What do you try and dial up and what do you dial down?
Well, I think one of the biggest pieces of misinformation spread by the United States government, and they've spread a lot of it, but one of the biggest pieces has been demonizing natural fats. Saturated fats, I'm not saying everyone needs to eat it, but it's a good source of protein. And when you're eating meats that are well sourced, that is a good source of nutrition. The government food pyramid demonized natural fats, moved the entire food industry to ultra processed foods, and created these refined carbohydrate addictions that have drove our obesity epidemic. I like nuts. I like fruits that are not coated with pesticides. It's especially important to buy organic when you're eating the surface of a fruit or vegetable. Strawberry, for example, has been sprayed over a dozen times with 7.8 different pesticides on average. The average school lunch program may have 38 different types of pesticides detectable. You can detect these things now in the urine of children, in the umbilical cord blood of mothers. So I'd like to eat, these are almost biblical principles, right? Things that grow out of good soil, clean meats, and do a little bit of intermittent fasting when I can.
Talk about intermittent fasting. Why is that helpful?
Well, I think in general, people are not getting enough protein. So I'd warn people about just starting to skip meals, because you really want to get a good amount of protein in your meal, in your day. But I just try it because I think it helps manage through a bit of willpower some of the appetite urges that I sense. I'll tell you what had a big impact is when I got rid of artificial sweeteners. The debate about artificial sweeteners got really hijacked by the do or do they not cause cancer argument. But I don't think they do. They've been around for a long time. But what they do is they trick your pancreas into thinking that a big sugar load is coming, and it doesn't come. So the pancreas is waiting for that sugar load, and it creates a craving and often results in binge eating of carbohydrates later in the day. So by getting rid of those artificial sweeteners, I think it helped manage my appetite.
So, which of these topics do you think the public is most informed about? What are the biggest myths in healthcare?
Well, I think for perimenopausal women, there's a myth that hormone replacement therapy, that is taking estrogen or estrogen plus progesterone when your body doesn't produce it anymore around the time of menopause, causes cancer. It's one of the greatest dogmas that's still alive and well, both in the medical establishment. And it turns out the study that was cited, where people say, aha, here's the study where we show it caused cancer, did not show a statistically significant increase in cancer. But the announcement was so magnificent and so broad by researchers at the NIH, the media ran with the story before they
Hmm.
ever looked at the data. The data were released later, over a week later. And by that time, the world had already been convinced of this dogma. Now, the reason I'm mentioning hormone replacement therapy when you asked what's one of the biggest misconceptions. Here's a medication that not only alleviates the symptoms of menopause, the hot flashes, mood swings, weight gain, night sweats, but also has long term health benefits because the blood vessels are healthier, nitric oxide levels are higher. And so heart attack rates in some studies are half, or they're cut in half because women who start hormone therapy within 10 years of the onset of menopause. The rate of cognitive decline goes down by 50 to 60%. The rate of Alzheimer's goes down by 35%. And a woman has stronger bones and is far less likely to break a bone or have a hip fracture. So the overall long term health benefits are overwhelming. Women live longer and feel better. But tragically, 50 million women have been denied hormone therapy since the time of this dogma announcement that it causes breast cancer.
Do you feel the same way about testosterone replacement therapy?
I don't. It's very different with men and testosterone. Both men and women have testosterone and estrogen. Now, some of the dogma is parallel. For example, the dogma that testosterone therapy causes prostate cancer. Another dogma, like the dogma that hormone therapy in women causes breast cancer, is not supported by the data. Now, there are benefits, and I do recommend people who are symptomatic get tested for their testosterone levels. And I do see people who benefit, men who benefit from testosterone replacement, but the long-term health benefits are not as dramatic as we see with hormone therapy in women.
But if you go on testosterone replacement therapy at 57 and you find you're stronger, your skin's a little more youthful, your erections are a little bit longer, do the benefits outweigh the drawbacks? Asking for a friend.
Uh, Look, yes, most of the time the benefits outweigh any potential downsides. People just need to recognize that if you're still making some testosterone on your own, you're probably going to shut that down by taking it
You're on
exogenously.
it the rest of your life. That's what they told me, yeah. And you talk a little bit about the chronic disease problem. What do you mean by that, and how serious is it for society?
Autism has increased 14% every year for the last 23 years. What's going on? Like, who's looking into this, right? We just keep medicating kids when they come in. It's now 1 in 22 kids in California born today will be diagnosed with autism. I mean, it barely existed. It was rare just 2 generations ago. It's still rare in the Amish community, in other parts of the world that have not adopted the Western diet. And I think the autism cause discussion has also been hijacked by the is it or is it not vaccines after a fraudulent study suggested it was due to vaccines. But we got to put that aside and talk about the microbiome, the lining of the GI tract, the garden of bacteria that normally live in harmony, millions of different bacteria that we alter, we throw it off, we carpet bomb it with ultra processed foods, antibiotics, even C-sections. Antibiotics and C-sections can save lives, but they're massively overused, especially antibiotics. And a study just found that kids who take antibiotics in the first couple of years compared to kids who do not have higher rates of learning disabilities and obesity and celiac and asthma. And you may wonder, how could altering the microbiome affect mental illness? Well, some of those bacteria make serotonin. And if you look at the diets of people in Europe, it's very different. They have far less chemicals. They have lower rates of mental illness, of autism, of obesity, of autoimmune diseases. Autoimmune diseases now affect 1 in 5 women. What's going on here? My field is pancreatic cancer. As a surgeon at Johns Hopkins that specializes in the pancreas, pancreatic cancer rates are going up, and no one is asking why. We do more pancreatic cancer work than any hospital, more pancreatic cancer research than any center in the country. Nobody is asking why. We've got
Mhm.
to ask these big questions and talk about root causes.
It's interesting because I think of pancreatic cancer as a death sentence. I just think it's game over. Is that not true?
So of those who get to surgery, which is a subgroup, maybe 20 to 30% of people can have the option of having surgery. The 5-year survival rate's about 20%. So it's pretty bleak, and we have not made a lot of progress in the last 30 to 40 years. So I think that we've got to talk about root causes. Same thing with Alzheimer's. Alzheimer's is skyrocketing, and we spend billions of dollars on these expensive new medications that get a lot of excitement that honestly, they barely work and they have high side effects. And we're not talking about the study that the Mediterranean diet was found to reduce Alzheimer's significantly. Hormone therapy in perimenopausal women reduced Alzheimer's by 35%. And Alzheimer's is associated with poor quality sleep on a chronic basis. So we could do a better job talking about these underlying root issues.
But I mean, it sounds like, and common sense is obviously where the insight is. I've had doctors Attia and Huberman on my podcasts. I'm always amazed how much shit they get because what they say to me feels pretty common sense. Get good sleep, eat better, eat out less, eat at home more grains, more vegetables, less processed food, and make sure you get some exercise. I mean, I'm not saying these things are easy, but aren't they pretty basic? And what you're talking about is preventive, offensive healthcare as opposed to defensive healthcare after something's gone wrong. Is that accurate?
Look, I can tell you, Peter Attia was with us at Johns Hopkins, and he is as superb as they get, evidence-driven, science-based, logical, common sense, and lives what he says. And so a bunch of us now are going directly to the public to try to educate them about these issues, to say, yes, it is common sense, but you'd be amazed. 90+% of our food supply is sprayed by pesticides and multiple times. You just saw the court case now open up the window to removing fluoride from drinking water, or at least not adding it. This was a dogma for decades that we had to have fluoride in drinking water because it supposedly reduced risks of cavities. Well, how about stop drinking sugary drinks if we want to reduce cavities? And if the fluoride is killing the bacteria in the mouth, reducing cavities, what do you think it's doing to the microbiome bacteria in the gut? So these are the big questions we've not been asking that we need to ask.
We'll be right back. Curious what you think. I'm in LA, and whenever I'm in LA, I have a buddy here who's what I'll call going through a midlife crisis that he's going to grow out of in about 30 or 40 years. And he always takes me to these kind of fabulous parties with a lot of very young, very fabulous, very attractive LA people. And the thing I've noticed that's changed among a younger generation is they have substantially reduced the amount of alcohol intake, and they've replaced it with drugs, ketamine, MDMA, edibles. Give me your thoughts on the health impacts of alcohol versus psilocybins versus some of these designer drugs, for lack of a better reason. And I recognize that ideally you don't do any of these things. Well, and I'll cut to the chase. I drink way too much. It's where my health falls down. Imagine you're someone who is always probably going to have a certain level of substances in their life because correctly or incorrectly, they've identified it enhances their life. What substances would you stay away from, and how do you feel about the impacts of some of these more trendy designer drugs?
Well, I can tell you about alcohol. So, as a doctor who has dealt with liver and pancreatic issues for a long time, if there ever were any tiny benefits to the heart from drinking a glass or two of wine a day, they are far eclipsed by the damage done to the liver. So, people are look, I understand people have their rituals and they if they want to drink a glass of alcohol, I think it's safer than cocaine. But more people die of alcohol abuse than opioids and fentanyl. And so I think we don't talk enough about the abuse potential, as people need just to be mindful of that, because it's one of these things that it's in our blind spots in medicine. We just sort of ignore the fact that we have 100 up to 170,000 deaths a year from alcohol. We don't need to be celebrating and glorifying abuse of alcohol, and can promote more responsible drinking. And for those who choose not to drink or drink rarely, which is what I do, you're going to probably sleep a little better and sometimes have a healthier liver.
What do you think of like ketamine, MDMA? I was shocked how many young people would either not drink, nurse a drink, but they were on ketamine or MDMA.
Well, it's a mixed story, because sure, while we don't see the same deaths as we do from heroin with some of those external exogenous drugs, there is the potential for abuse. You just saw the star of Friends suffer with ketamine overdosing. It can be addictive. In the past, we used to use lower doses. Now that it's more available and people are trying it, there's an abuse potential people may not be aware of when they first try it. So, I mean, I'm probably not the best expert to answer those questions, but certainly we see an abuse potential pretty broad. Marijuana is one that I know more about. I wrote about in the book Blind Spots. There's a dogma that it's totally safe, and I try to dispel some of that, because sure, it's safer than cocaine, but the idea that it's not a gateway drug. We may want to believe that, but that's not really what's supported by the data.
Say you use it once or twice a week to help sleep and wind down instead of alcohol, and it hasn't been a gateway drug. Again, asking for a friend. What are your thoughts on edibles?
Marijuana today is not the marijuana of Woodstock. It's about 10 to 20 times more potent, so you want to watch those doses. You want to be aware of the fact that it acts differently in an adult than it does in an adolescent, where a developing mind may be more susceptible to the risks of future psychoses. In one study, 25% of people who use it regularly as a teenager will go on to have some psychosis-related diagnosis in the future. So it may be more dangerous in the developing mind in adolescence.
You said in an interview with PragerU that there's no reason anyone should ever sign a financial document in an emergency. You suggest to write, did not read, or this is not a contract instead. What did you mean by that?
Yeah, so by law, hospitals are required to take care of you for any urgent or emergent situation. And what hospitals increasingly have been doing is putting this financial contract, telling you, almost manipulating you to sign your life, home, mortgage, retirement, savings away under penalty of law, just to be treated. And that is, if it doesn't violate the letter of the law, it violates the spirit of the law. You don't have to sign your forms away. My team has
Hmm.
done a lot of work on hospital price gouging and predatory billing. And we found that hospitals sometimes sue patients in court to garnish their wages. This violates everything sacred in our profession. Hospitals are there as a safe haven. To take care of somebody and manipulate them to sign their life away financially, I think is predatory. I don't think anyone should ever sign a financial document in an emergency room.
So I'll put forward another thesis, and want to get your response. The majority of advanced nations have nationalized health care, spend about $6,500 per citizen on health care. We spend 12 to 13,000, yet we have worse outcomes, higher infant mortality, lower age expectancy, and yet the insurance industry, who has inserted themselves in the middle here, 45 cents on the dollar goes to administration and profits, which, as far as I can tell in terms of math, is responsible for the difference between what other nations spend on healthcare and what we spend. Hasn't basically the industrial health complex weaponized government, inserted profit institutions to the expense of American citizens?
I think there's a lot of truth in what you're saying. The question is, what's the solution? And I've spent a lot of time in my tenure
Hmm.
as sort of as a health policy expert in our at Johns Hopkins, talking about different healthcare systems. And I'm convinced there's a better model than what we have now. At the same time, while there's an attractiveness to moving to a single payer system, you cut a lot of the waste in the short term, a lot of the middlemen and the people profiteering off of, say, our billing and coding system. Ultimately, governments cannot resist 10, 20 years down the road doing across the board tightenings of the belt. And what it ends up doing is resulting in an underfunding of the healthcare system. And we've seen that even with our own government system, Medicare. It's massively underfunded, and it just becomes a declining priority after the initial enthusiasm to have some government. So it's a mixed picture. I tend to focus on what's feasible. And right now, my concern is we can have the most gold plated health insurance for every American. We can fix our broken healthcare financing. But if we are still recommending bad practices and not addressing our poison food supply, we're going to keep watching these chronic diseases extend.
So it feels as if many of these roads lead back to preventive health care, specifically around our food supply system. How do we fix that? Is it taxing these foods to their? I mean, my understanding is if you just priced water at its real cost, beef would be $20 or $30 a pound. If Bloomberg wanted to tax big gulps, is it taxing these companies? How do you address the externalities and fix? Is it more regulation, more pricing that reflects the damage of the externalities here? How do we create a healthier food supply system?
So, Scott, you're talking to a guy who's studied a lot of the unintended consequences of well intended government policies. So, I'm a little leery of things like strong government interventions. And so, what I would suggest is the government needs to stop spreading misinformation about food and nutrition. They need to stop purchasing with U.S. tax dollars dangerous foods. We do this in almost every school lunch program in the United States. Heck, we strip the fiber out of the food and feed it to kids like sugar and call it bread, even though it's really not bread. And we've got to sometimes help support these school lunch programs with subsidies to buy healthier foods.
Curious to get your thoughts on GLP-1 drugs.
We're clearly seeing a reduction in short term health complications when people lose weight. But just like you're losing excess body fat, you're also losing muscle mass. So everyone who prescribes these drugs is supposed to technically be saying that you're supposed to exercise like crazy and eat a high protein diet. But in the real world, people are not necessarily doing that. And we don't
Hmm.
know what the long term consequences are of losing all that excess muscle mass. Here's one little fact people may not be aware of. The number one predictor of how long you live is your muscle mass. So we may be accelerating frailty and even shortening lifespan despite the reduction in health complications in the short term.
God, that's wild. Yeah. So everything I read about Ozempic, every year I do a prediction seminar on technologies, and I said that in 2024 the most seminal technology breakthrough was GLP-1 drugs. The stuff I've read reduces alcohol consumption, biting nails. They're talking about giving it to people with gambling and social media addictions. Am I overestimating the impact this might have on our society?
I'm a little cautious about the premature celebration that we may now have a drug to treat addiction. And it may be a secondary effect because you probably feel better about yourself when you lose weight and may just have a more positive outlook and better willpower. So I'm a little cautious when pharma says we have a solution for everything. But I will tell you this, Scott. We are seeing now a new generation of GLP-1 drugs like Ozempic that are about to come to market. There's estimated to be 29 that are going to come to market in the next 20 years or so. And some of these now are designed to block that receptor on the muscle. So it may not reduce muscle mass, as is our concern with Ozempic and Wegovy and some of the others. So we'll have
Hmm.
to see. But here's a question I pose to most doctors when I talk to them about this topic. Have you seen anybody come off of Ozempic and keep the weight off just from diet and exercise? I'd like to see that be a nice population of people before I recommend it too broadly.
And final question, just something personal. someone in a high pressure job, you're obviously very ambitious. Any thoughts on being a good partner when you're trying to have the kind of impact you have and the demands it places on your professional life?
Yeah, I think what we've seen is that the happiest communities in America are those with strong social networks. And when you look at the Maslach work at Berkeley on workplace satisfaction, one of the greatest drivers of happiness at the workplace is the amount of positive feedback you get directly as a result of your time and services. And we're learning now in an amazing study that blew me away as a doctor that when you energetically and enthusiastically compliment someone else, then you actually increase your own endorphin levels at a level
Love that.
higher than that of an antidepressant.
Love that. Be generous. That's the best medicine. Dr. Marty Makary is a renowned surgeon and professor at Johns Hopkins, public health expert and leading advocate for healthcare transparency, and a two-time New York Times bestselling author. His latest book, Blind Spots: When Medicine Gets It Wrong and What It Means for Our Health, is out now. He joins us from New York City. Doctor, I really enjoyed this conversation. Thanks for your good work. I think it's having a real impact.
Thanks so much, Scott. Good talking with you. Appreciate it.